Tonight we've got Dr. Ryan speaking for us. Dr. Ryan is a partner at Raleigh Neurology. He's the medical director of the WakeMed EMU. He has been part of UCLA, Cedars-Sinai, and then he got tired of California and went east to Raleigh. And he's one of the guys who's helped to use us from a long time ago, helped us build this product, and now he's going to speak through some of our case studies. So that put it out there. Go ahead.
Well, thanks for having me. So today we're going to just go through some cases, think about how the device can be used. So for those of you not familiar with the device, it's a wireless, ambulatory EEG device. It's worn here, behind the ears, on either side. Continuously uploads to the cloud, and then has a AI system that overreads it once the data is recorded. What's really nice about this is it's approved for 30 days. So patients who have rarer events, you're able to get data on. It's also something that can be removed. I have patients who say, hey, I want to take a shower, I want to go work out. They take it off, they put it back on. And it gives you a really nice representation of the data. And so here you have an example of how the montage comes out. It is limited, 10 channels, but billable. Here you have more of kind of a longitudinal montage, because that's how a lot of us look at EEG. But it can also be flipped into a transverse montage to get a different representation. So let's dig into some cases. So the first case was a patient I caught a really beautiful seizure on, which sounds funny to the non-epileptologists here, but epileptologists know how pretty seizures can be. So this is a 30-year-old woman. She had pediatric epilepsy, which she believes she had grown out of, but had started to have some episodes where she was kind of shaking, losing consciousness for a second, maybe a few seconds. Not sure what these were. Was she just tired? Was something else happening? But they were rare. These weren't episodes that were happening every day. They weren't happening even every other few days. So we were able to put on the REMI device for about 7 days and capture 3 nice seizures coming from the left frontal region. She was started on levetiracetam and isn't seizure-free yet, but has had a decrease in her events. So here you kind of see the building frequency and amplitude in those left frontotemporal leads. And then see that kind of peter out and lead to some kind of focalized suppression there as well. And so what was really nice for this, and this was one of the earlier cases that I was really excited about, is these events were captured past the 72-hour period. So if we'd put an ambulatory on this lady, I would have never known that these were clear focal seizures. Would have said maybe. We would have maybe trialed and errored meds, not given her any type of clarity about what was going on with her disease. So case number 2 is the intermediate, the interictal. For those of us in neurology, we know neurology is not black and white, it's gray. You live in the middle a lot of the time, and you have to hedge and figure out what's going on. So this is a 52-year-old man. He had a past medical history of hypertension and childhood meningitis, which is always a red flag for us when we're thinking about the risk of developing epilepsy. And he was having recurrent episodes of deja vu since the age of 16. It's wild what patients with epilepsy will live with, right? Having deja vu a couple times a year for him wasn't a big deal. But in the half a year before he came to see me, he was having increased episodes, about 3 across a 6-month period. And then the REMI device was placed on him, and we were able to capture some of these frontal episodes with 4 hertz, frontal waveforms, not with a clear, pretty, crescendo or decrescendo of waveform, but a, kind of clear onset and offset, like an abrupt onset and offset. And so him and I made a, mutual decision to try lacosamide, and he's now episode free. He has not had any further, clinical seizures. And then the last patient, we're going to talk about tonight, and all of us have these patients in our practice, are rule-outs, right? These are a lot of the patients that need event characterization. We're not sure what these episodes are. We might be suspicious that they're, functional seizures or psychogenic seizures, or suspicious they're vertigo. And epilepsy monitoring unit beds are precious, right? It takes months, if not years, to get people into the EMU. And so being able to event characterize without the hospital is essential. So this is a 57-year-old. He had long-standing epilepsy, actually, and was worried that he was having breakthrough seizures after 30 years of seizure freedom. He was noticing increased breathing, concerns, especially during his job as a landscaper. When he was kind of hyperventilating, he was having these episodes. And as a landscaper too, traditional wired ambulatory EEG was going to fall off. He was sweaty every day. He was dirty. He has to jump in the shower, get clean after his episodes, or after his work. So we threw the REMI on him, and we caught multiple episodes that he nicely was able to annotate in the REMI device, the handheld device. And they all showed kind of this mixed frequency, flat amplitude background. Made me very confident that these were not seizures. We didn't make a change to his seizure medications, and he now can live confidently that these episodes are not breakthrough seizures. He doesn't need to make a big change to his daily life, and we don't need to trial a new medication, which we know all anti-seizure medications have a cost. None don't have any type of alternative side effect. So those are kind of three examples from my world. Happy to answer questions if anyone has one. Happy to also talk on a one-on-one basis. Really excited to this new tool that I've brought to my private practice. We're launching it across all of our 50 providers now, and it's been a great adjuvant to increase the precision that I'm able to offer to my epilepsy patients, not just test things, out of nowhere, but actually have data, about what's going on with these patients' brains. Thank you.